Welcome, everyone, to EMDR Chat with Curt and Michelle. I'm Dr. Curtis Roundson.
And I'm Dr. Michelle Gottlieb. Curt, we have a guest again today, and it's someone you know.
No.
Yeah, seriously, you know her.
Well, I suspect it's someone from the Midwest, and they are the best stock. That's it.
How did you know? All right. So, we've had a lot of people ask us about doing intensives.
Yes.
And so we have a member of our faculty team who knows a lot about doing intensives. So everyone, let me introduce you to Amy Ikerd. She has been practicing as a clinician for over 20 years. She is in Indianapolis, so yes, Midwest, you are correct about that. She's been trained in EMDR Therapy since 2014, an approved consultant since 2021, and yes, part of our training team. She's a facilitator for EMDR professional training. And her practice specializes working with first responders, but also doing intensives. And most importantly of all, she has 2 therapy dogs that are just absolutely adorable.
But Michelle, I have a question.
Sure. What's your question, Curt?
What in the world is intensive?
Right? Amy, would you like to jump in with what is an intensive?
Yes. Well, first of all, thank you guys so much for asking me. I'm very pumped to talk about this. So there's not a hard and fast rule, so to speak, at least yet, on what an intensive is. But it's typically expected to be a session that's 2+ hours. And I know different folks structure them differently. They've become very popular over the last couple of years. So anything that's about 2 hours or more. And so it would be extended beyond the normal clinical hour.
So when I have people come in and they, for an extent, like for 5 days straight, and I do 2 hours sessions with them, I'm actually doing an intensive.
Yes, absolutely.
All right. Now, I guess I could talk about this now, Michelle.
You could, but we already asked Amy, so too late. So, I'm curious, and people, I know there's a lot of trainings going on about intensives and all kinds of goodies, but what really is, besides the length of time, is there anything that's different between a standard, whether it's 45, 50-minute, hour and a half, typical EMDR reprocessing session and an intensive session? What's different?
Sure. At least for my intensives, they are more of an experience. So the way I structure them is a little differently than a lot of people who do intensives. What you might see advertised is like 2-day, like half days for 2 days or 3 days or full days. I see anywhere from 2 to 5. I do an intake and then I start scheduling 3 to 4 hour blocks every couple of weeks. And that client also gets digital EMDR guidebooks that I helped create. And so it is based on typically the treatment plan, or for some folks, they will come and say, I have this amount of money and I want to try to do this many things. Please tell me you can make it happen. So it is short term. I customize it kind of like an intensive outpatient program for that one person.
Okay. Curt, as you said, you do intensives like 5 days straight. Do you do it differently?
No, it's pretty much the way Amy described it. As I said, they'll come in for an extended period of time, usually travel in, and we, as Amy said, we develop a treatment plan and what we want to cover, whether it's 5 days, and sometimes they've come in for 10 days, 2 weeks straight. And I like it, and Amy can probably speak to this, because we get years of psychotherapy done, talk psychotherapy done in those few intensive hours. That's my belief.
Amy, is that your experience as well?
Yes. What I see is much quicker symptom reduction, even completion of a comprehensive treatment plan. And it's going to be an it depends, obviously. Right. But seems to me, in my experience, and I am finishing out my 4th year, just getting results in symptom reduction and improvement so much more quickly, rather than the client coming in weekly for a year or 2 years. And the way I structure it, I'm working with someone once every 2 weeks typically. So usually within 60 to 90 days, they've completed the treatment plan.
And because you work with first responders, I'm wondering if because of the nature of that population, you move to an intensive to get them back to work or back regulating themselves on the job more quickly. I'm curious, what got you doing intensives in the first place?
Well, I would love to do intensives with first responders. However, all my intensives are with civilians, and this is actually how I
Interesting.
This is how I continue to work with civilians at all. Is I have a collaboration with the Indianapolis Metropolitan Police Department, which means I need to keep flexibility in my schedule for officer-involved shootings, critical incidents, and other crises. And so let's say I'm seeing an officer and I'm doing RTEP. I would love to be able to do an intensive and get that officer in and out. But the way that the city of Indianapolis pays for therapy is still the 1 hour at a time. So I'm working on that to kind of shift that, because this is a paradigm shift. And for clients and for payers, both. It's a complete paradigm shift from what we're all used to.
Right, because insurance, you have to have medical necessity.
Yes.
Which is one of the many reasons we all hate insurance companies and try not to use them.
Well, the whole idea of 1 hour a week has been based on insurance companies, not upon what is really the best interest of the patient.
Right.
Absolutely.
Yeah, that's what we've always done. But it doesn't mean that it's actually more effective or more beneficial for the client to do it that way.
Right. All right. So I'm curious. I've done a few intensives. I don't do a ton of them, because my schedule doesn't allow for it. But what would either of you say about when would be contraindicated? Who would not be appropriate? Or when would it not be appropriate to do an intensive?
Well, I would say depending on the level of the client's dissociation and their ability to resource that, especially if I was offering, like, you come into town and you work with me for 2 days and then you go on your way. So I am really looking for what is their stability. And I get a lot of good data during their intake, because I do a safe, calm place during their intake. And I get a lot of good data even from that on how they can regulate or state shift. But I will say I have done an intensive with someone that was DID before. And it wasn't apparent until we did the safe, calm place that I was like, oh dear, okay. And this person really, really wanted the intensive experience. And so I then phoned a friend, got a hold of Patricia Torres and said, please help me structure what I need to do to keep this client safe and help them have this experience. And we were able to do it successfully. But that is not my typical intensive client.
And just as a quick aside, RTEP is a recent traumatic episode protocol that Amy had mentioned. And Patricia Torres is an approved consultant who's just finishing up her doctorate. And one of her specialties is complex PTSD and severe dissociation.
And Patricia is working with the best. She's working with Sandra Paulson.
Yeah.
And Sandra only does intensive, I believe, in this area.
So, Curt, who would you say you would not do an intensive with?
Well, I agree with Amy 100% on this. It's really about emotional regulation. If I'm going to spend much more time doing emotional regulation kinds of things, safe, calm place, container exercises, that sort of thing. And I would want to know that they can do that and practice that after a session, in between sessions. And if they're only there for a couple days, I'm going to be very cautious I'm going to be probably symptom reduction oriented, like EMD or recent events protocol if it's something recent, and stay away from comprehensive treatment until they're able to stabilize and emotionally regulate.
And I love hearing how both of you structures differently. Amy, you do like every couple of weeks. Curt, you do daily. And I want people to hear there is absolutely no reason, unless there's something very specific to that client, that you can't do every day, that you can't do EMDR therapy reprocessing every day. It gets them through faster. As Curt said, years of therapy in a short period of time.
Well, also you go back in talk therapy, one of the things that we'd say we're doing a session once a week, for instance, as again, a lot of that had to do with insurance companies because, as you may or may not know, historically, Sigmund Freud saw his clients 5 days a week, and he did analysis. And one of the things about being able to see them as often as you can is that they move through it faster. In talk therapy, we say they need the week to process what we talked about. what we're doing in our EMDR session is reprocessing. So they don't have to go out and spend time consolidating it so much in between sessions, because the consolidation is actually happening in the session. And the more quickly we go through it, the quicker their results or their symptoms go away.
Right. Absolutely.
And, our colleagues in the Netherlands have done a lot of good research validating exactly what Curt just said, that intensive model, even for highly dissociative clients, can be very effective. So I agree. I don't know that having to spread it out 1 hour a week is always what's going to be best for that client.
Yeah, and unfortunately, I think you already referenced the fact that what's best for the client is not always what allows them to have their sessions paid for, insurance to cover, etc. So it's a constant balancing act between what's possible in an insurance-based or policy world versus what is in the best interest of the client.
So let's talk. Yeah, right. And that is part of that whole paradigm shift. But let's talk about how the sessions are actually structured. I know when I've done longer intensives, one of the things that I build in bathroom breaks. Is there anything else you would think about that again would be different than what we would necessarily do in the shorter sessions?
Bathroom breaks, and not just for me and the client, but whatever dog is here that day. And then quick snack breaks. And because I bill hourly, I'm very mindful. Like, I stop the clock when we take a break. And so that way I'm mindful that we're not actually working during that time, but we tend to get in here and get moving, and we might take one break and then we get right back to it.
Curt, do you do anything in your structure?
I have to be very mindful of the fact that if we're dealing with early childhood traumas, that we're going to tap into memory networks, and children often have to go to the bathroom more than adults. And so, ironically, when we're dealing with early childhood trauma, it's not uncommon for an adult to say, for some reason, I have to go to the bathroom. And I say, no problem. So that's the other reason. So we build those in, yes, breaks.
Yeah. Is there anything else that you guys would think about that as people are starting to move into doing intensives? Anything else that someone's going to need to be aware of as they're starting to schedule this?
Well, there's probably a few different things. So it's going to be, and it depends, but if someone takes insurance, the first thing they would want to consider if they want to start adding intensives is they're going to need to get those contracts out and probably consult with their attorney, which is what we did, which we got clear answers on. If the client signs an opt-out form, then we are free to move forward. You can try calling the insurance companies also, which we did, and they talked in circles. So, which is right. So the attorney then gave us the green light to, yes, you're cleared, even though you might be paneled with their insurance.
So if you do an opt-out for this particular client for these particular sessions, then they're paying you directly. You're not billing the insurance company.
Right. And we also don't provide super bills because intensives are not considered medically necessary, right, yet. And the EHR code that we use is not going to match up. And they took away the extension codes in 2023. You used to be able to bill the hour and that's gone, which in a way that made it easier for us to just say, I'm not going to work for 4 hours and get paid for 53 minutes. So,
Amy, why not? Come on.
I know, right?
So think about that whole insurance thing, talk to an attorney, get the opt-out forms. Anything else as people are moving into doing intensives? Is there anything else they need to be thinking about or planning or?
That was my question, Michelle. Thanks for asking it.
You're welcome. I'm there for you, Curt.
Well, some things maybe to consider is to not skimp on the intake, because that is very important. And in fact, my intensive intakes are longer than if I was just seeing someone for hourly therapy, because I'm going to start phase 2 preparation even in that first session, and I'm really going to start nailing down the treatment plan. So without a comprehensive intake, there's the potential that something is missed.
Yeah,
Um,
sure.
I really believe that you really need to have mastery of standard protocol, and you'll need to be able to figure out how to move through blocks and stuck points quickly, because it's a longer session, but you still have a short term with this person. And I want to get them from A to B. So you have to be able to shift gears quickly to figure out, what do I need to do to keep the train moving down the track?
Interesting. Okay, cool.
Well, and I think that's important. What Amy just said is very important, because when someone is just trained in EMDR, one of the common blocks that happens for the therapist is that when the patient gets stuck, it's often the therapist that gets frustrated and gives up and moves into talk therapy,
Right.
which does not allow the memory to get reprocessed, and it actually slows it down. And as she said, moving through, knowing cognitive interweaves, knowing how to do affect scans and float backs, and how to move through those stuck places, and mastering that is very helpful when it comes to intensives.
Both of you, well, you haven't said it explicitly, but let's clarify. Would you only do an intensive in person, or would you consider doing an intensive virtually?
My preference is in person, and I'm only licensed in the state of Indiana.
Right.
So I could do, and I have done it one time with an existing client that wanted to do an intensive to get a bulk of work done, but they live about 2 hours away, but they were still in Indiana. But you miss out if it's not in person, because I also include neurofeedback therapy with my intensives, and kind of hard to do that virtually, right? So preference for me is in person.
Curt, have you ever done it virtually?
No, I've done it all in person. I don't know. I suppose that you could do it virtually, but the same thing. There's something about it in person, and the person being in front of you and being able to really assess what's going on and being attuned to them while they're doing deep, intensive work. I prefer in person.
Yeah. And kind of going off of that, when you talk about treatment planning, and you've both talked about symptom reduction, would you do the treatment plan differently? Like maybe not doing the really deep, dark uglies, or how do you guys figure that out? What you're targeting, what your treatment plan is going to be about?
Oh, it depends.
That's my answer, you guys. You have to stop stealing it. What helps you decide that, though?
It's twofold. It's what the client desires, but it's also what's going to be realistic and reasonable. And for most clients, they are able to do something that's more recent. Like I've had a few recently, like medical trauma or different medical disorders that are now creating panic, and it's really disrupting their lives. Or I had someone recently where it was a dog attack. So then there were subsequent dog interactions, but they did not want to go back to childhood. Right. And so even though there was a sense, or I had the direct information that there was childhood trauma, I had to be very intentional about how I stayed and kept them on that treatment plan. For some clients, that's not as reasonable. So I might be doing an intensive just for stabilization and symptom reduction. So that's going to be a lot of resourcing, EMD, present triggers, maybe recent things. And maybe even a little bit of future work just to strengthen those adaptive networks.
Yeah. Curt, do you want to add anything besides it depends, or is that going to be your complete and total answer?
No, I think that's exactly what I was going to say. So there.
Oh, so your answer is not only it depends, it's also ditto.
Ditto.
Okay. I know, like, for me, one of the main reasons that I don't do intensives is my practice is full, and it's hard to get blocks of time to schedule the intensive in. What would you just say to someone like me?
Well, I wish I had all the answers for that, Michelle, because I still do take hourly sessions for those law enforcement referrals. And sure. I am a consultant and I am a basic training facilitator. There are some weeks where I don't maybe have a day off, right? So I really try to reserve my intensives for Thursdays, Fridays, Saturdays, or Sundays. It just depends on the week. So my
Sure.
days off might fluctuate. So what I say to consultees that are interested is block off and reserve days just for this. And you can fill those in. If you have clients that are on a wait list in particular, you can fill that in if you're getting close to the time and you don't have an intensive for that day.
That's a good idea.
Yeah.
So we are about out of time. Curt, did you want to add anything to that?
No, no. I just I usually schedule it like a month ahead, so that I know that I have the time, and that they'll make plans to be in Newport when I'm at those times. So, yeah.
Okay. Well, Amy, thank you very much for
Yes.
all that you said. Some really interesting things for us to think about and talk about, and I appreciate your taking the time. So thank you, Amy.
Thank you.
Yes,
Thank you for
Amy.
having me.
Thank you very much. You're very welcome.
And as always, there's a 10% coupon for just listening to us because we appreciate you. Tell other people about EMDR Chat, and hope we all see you soon.
Until then, go with that.
Bye.
Bye-bye.